A lot of people are always like, what do we do? What can we advocate for? Well, back in 2021, there is this thing called the Vaccines Plus strategy, where many scientists signed on to this as something that should be done. Where Vaccines Plus is a combination of vaccination, public health, and financial support measures, as these combined measures would sustain low infection rates, and that where countries that rely on a vaccines only approach seem willing to tolerate high levels of infection within their communities. And this is all underlying the assumption that healthcare systems can cope with this increased burden. And that even back in 2021, this population immunity based off of vaccines only approach seems like it wouldn't work because Delta and Omicron already suggested significant immune escape. And at that time, they had already been seeing that the virus has been continuing to increase in transmissibility and increase in immune escape, which means that there's greater pathogenicity over time. Ultimately, underpinning that the virus is mutating in such a way that it is going to side skirt this natural immunity and this vaccination-induced immunity, so you need to do other mitigation measures as well, and also the fact that it's becoming more and more transmissible and more infectious over time. Where countries which suppressed transmission early on, such as China, who did a zero COVID policy, they saw reduced mortality and less economic damage in the long term. And while vaccination greatly reduces risk of serious illness and death, long COVID still remains a concern. And that adopting a vaccine plus approach would allow everyone, including those clinically vulnerable, to go about their lives more freely. So what does this look like? So again, this is a 2021 declaration. It's 2024 now. But the first point is unequivocally declare COVID an airborne pathogen and stress the implications for preventing transmission. Promote the use of high-quality face masks for indoor gatherings and other high-transmission settings, and using respirators like N95s for healthcare workers at all times. Move to an effective ventilation and filtration of air system. It's time to go beyond opening windows and aim for a paradigm shift to ensure all public buildings are optimally designed, built, adapted, and utilized to maximize clean air for occupants. Support urgent measures to achieve global vaccine equity, including vaccine sharing, suspension of vaccine patents, and the removal of barriers to technology transfer, and establish regional production centers to create a plentiful local supply of high-quality vaccines everywhere. And then there should also be a coordinated effort to tackle misinformation to ensure people have access to timely, accurate data on vaccine effectiveness and protection, which means calling it out, snuffing it out, and then making sure the right information is communicated effectively to everybody. And Vaccines Plus is an affordable and achievable strategy where on December 14th, 2021, we even have a quote here, "I need to be very clear, vaccines alone will not get any country out of this crisis." And they haven't, especially with only one vaccine a year. It's insufficient. And that it's not vaccines instead of masks, it's not vaccines instead of distancing, it's not vaccines instead of ventilation or hand hygiene. Do it all, do it consistently, and do it well.